Hi, my name is Megan and I'm going to be your nurse today, and we're going to be doing a hair, skin, and nail assessment that should take about 7 minutes. So I'm going to start off by washing my hands, and no further PPE is needed for this assessment. So can I start off by seeing your ID band, please? And can you state your name and date of birth?
Haley Jenkins, 12/21/2000.
All right, thank you. And I see you have no allergy band, so you don't have allergies, correct?
Correct.
All right, so I'm going to start off by assessing your skin. So a patient's skin appears to be tan, even throughout, and proper for ethnicity. Next, I don't notice any birthmarks. Do you have any birthmarks that I should know about?
I have one on the inside of my leg.
All right, thank you. And then patient's skin has no odor and appears well kept. Next, do you have any scarring that I should know about?
No.
All right. And then you don't see any ecchymosis. So do you have any bruising that I should know about?
No.
All right. And then I don't notice any track marks or cutting. Do you have any tattoos?
No.
All right. And then any piercing other than your ears?
My nose piercing.
All right. Then I don't notice any striae or asymmetrical vascularities. Do you have any stretch marks or spider or varicose veins?
I have stretch marks on my legs.
All right, thank you. And then I don't notice any edema. Do you have problems with swelling?
No.
All right. And then I don't notice any lesions that would be an issue. Do you have any moles that have recently changed size, texture, or shape?
No.
All right. So moving on, I'm just going to assess for temperature using the dorsal of my hands. So patient's skin appears to be warm and even throughout. Then using my fingers, I'm just going to assess for tenderness, texture, mobility, moisture, and masses. All right, so patient's skin is smooth and dry. Did you notice any tenderness?
No.
All right, and the skin was mobile, free of masses, and that's it. So next I'm going to test for edema by your ankles. Right, so there's no pitting and appears to be no edema. And I'm going to assess for skin turgor by pinching some skin above your clavicle. All right, there's no appearance of tenting. All right, so then moving on to hair. Is your hair dyed?
Yes.
All right, so a patient has medium length, dark brown artificial hair that appears to be well kempt. I'm just going to take a look. All right, so there is no lesions and any signs of like infestations such as lice or dandruff. And patient has proper hair growth for a female with no alopecia or hirsutism. And texture is soft. So next, moving on to your scalp, I'm just going to take a look at your color. So it is shiny and pale, which is good. And then also there's no signs of lesions or anything that would be a concern on the scalp, and appears to be well kempt with no infestation such as lice. So next I'm going to palpate. So did you feel any tenderness?
No.
All right. And then patient's scalp was mobile, free of masses and lesions. All right, so next moving on to your nails. Patient has artificial long nails, so I would assess for pink color under the nails, and then I would also assess for length, which appears to be long. Nails are well kempt. Next, can you go like this for me? Which I would be assessing for clubbing, which patient appears to have no clubbing. And then I would assess for texture, which is smooth, and then capillary refill by pressing on the nail and making sure that the color comes back within 3 seconds. Right. And that's all I have for you today. I'm going to go let the doctor know, and they'll be in with you shortly.
Thank you.